Hi, my name is Kate, and I'm a surgical physician assistant. I've been a PA for a little bit over a year now. I'm so excited to be able to share my journey and my thoughts with you and give you some insight on the PA profession. So first question, what kind of PA are you, and what type of training did that involve? So I said before I'm a surgical PA, but specifically practicing in acute care surgery and trauma. My journey to becoming a PA started in undergrad where I got my bachelor's in biology. After graduating, I took a gap year before starting PA school so that I could take some classes to boost my GPA and just really bulk up my application so I would be a great candidate when applying to PA school. I then went on to PA school where I got my master's in physician assistant studies. PA school on average is about 27 months. The program I went to was accelerated, so it was 24 months. What this consists of is one straight year of intense didactic, and then the rest of your PA program, mine was just 1 year, is clinical rotations. So about my job, as an acute care surgery trauma PA, we see a variety of patients, mostly in the emergency and acute care setting. For the trauma part, where I work, we're a level 2 trauma center. So any trauma activation, gunshot wound, stab wound, bad car accident, anything like that, we respond to. And as the PA, we're the ones doing the primary and secondary survey, while the trauma attending sits back and oversees everything to make sure that everyone's doing their job and everything's running smoothly. As the PA, we get to do procedures like chest tubes, central lines, we use the ultrasound for fast exams, really anything you can think of. We look over the imaging and labs of the trauma patient, and then the other half of our job is the acute care surgery part. So we get called for consults for things that show up in the emergency room, like acute appendicitis, an acute gallbladder that needs to come out, small bowel obstructions, a whole variety of things, but anything acute that's a general surgery problem, we get called for and we go see the patient. And then in the OR, we're the first assist. We get a lot of hands-on responsibility as the surgical PA. Can you tell us what a typical day looks like for you? A typical day in acute care, surgery, and trauma starts with sign out at 6 a.m. with the whole team. We run through our patients and any updates or events that happened overnight, and then we discuss our plans for the day. We then go around on all our patients and write our notes. Depending on the day, surgeries start usually at 7 or 8, and then in between cases, OR cases, you're checking on your patients, seeing how they're progressing with any changes that you made earlier in the day, and adjusting anything that you need to so that you're continuing to have your patients move forward in their hospital course. And of course, you can't forget responding to any trauma activations that are happening or surgical consults that come up in between those times. After each case in the OR, we were putting in post-op orders, and each patient who went to the OR needs a post-op check, which means you're seeing them, making sure they're doing okay post-op, and writing a note on that. And before you know it, it's 6 p.m. and you're ready to sign out to the night team. What made you decide to go into your field, and did you always know it was what you were meant to do? So it wasn't until I was a junior in college that I even found out what a PA was. My roommate was pre-PA, and as soon as I heard what a PA was, I was sold. For me, there were many key factors that drew me to the PA profession. PAs are versatile and collaborative. One unique thing about the PA profession is that unlike medical school or nurse practitioner school, you aren't required to specialize. You graduate with a general medical education, and you can choose any specialty you want. With that being said, if you come out and your first job is in the ICU, if you wake up one day and want to be a surgical PA or outpatient office PA, you can just do that without any additional training or schooling. That flexibility was huge for me because I couldn't imagine being committed or limited to one area for the rest of my life. Financially, it also made more sense. I knew I wanted to be able to diagnose and treat patients, but I didn't want the financial burden of medical school and residency. So with the 2-year PA education, it financially made a huge difference. Another unique point is that you aren't required to do a residency before you start working. So there are programs that offer a PA residency after you graduate, like in emergency medicine, critical care, and surgery, but this is totally optional. After graduating and passing my boards, I was able to jump right in and start working as a PA. What did you find most beneficial in preparing for your career path? One thing that's required when you're applying to PA school is patient contact hours and shadowing hours, which I think are so crucial to solidifying your path to becoming a PA. Patient contact hours can come from being an EMT, an ER tech, a CNA. It allows you to learn how to talk to patients and just get basic skills like getting vitals, asking a history. For my contact hours, I was an EMT for 3.5 years, and I quickly knew I wanted to be in some form of emergency medicine in my future. I learned that I thrive in a fast-paced environment. And then later on, during rotations, I fell in love with surgery. So everything on your path points you to where you belong, whether it's your profession, your specialty, your first job. You learn along the way what you like, what you're good at, and where you fit. For shadowing hours, those are super important too. You really have to shadow a PA to see what it's like firsthand. You can read all day, but getting to see the day-to-day and the responsibilities of a PA is a whole new perspective. You get to see how PAs are involved and how we fit into the medical team. This allows you to see the variety of roles depending on the specialty. You get to understand the profession and see whether it's the perfect fit for you and your goals. It also opens the door for networking and making contacts with people who can guide you and even mentor you throughout your PA journey. What extracurricular activities did you participate in outside of regular coursework? So during undergrad and a little bit in PA school, I did intramural soccer, which I think kept me sane. The path to becoming a PA can be intense and overwhelming, so it's important to have an outlet and remember to take time for you. I also did Bikram yoga, which is hot yoga in 100 degrees. Kind of crazy, but that played a huge part in keeping me grounded. It's easy to get wrapped up in studying and forget about your mental health and well-being, but honestly, that's just as important, if not more important, to your success in your future, whatever you choose to do. So I would say don't forget to take time for you, and just because you chose this path doesn't mean that you have to give up hobbies that bring you joy. How did you maintain focus to study and prepare for your exams during school? So in undergrad, I was so excited to finally be able to study and learn something I enjoyed, and that was interesting to me, so it wasn't as painful, and it didn't feel like a chore to me, and that was the first step. Along the way, I found out I did better studying in groups. So before a test, we would all meet and go over questions and test each other, and that really helped. Before PA school, the Christmas before PA school, my mom bought me this gigantic whiteboard, and I brought it along to PA school with me, and I put it in my room, and I would cover it from top to bottom every single week with all the material we learned. So I think finding out the way that you learn and study the best is important, and then doing whatever you need to do to accommodate that. Being a visual learner, it meant getting to use fun colors and draw on a whiteboard every week. So what are some key points that I want you guys to take home from this video? If I could have you take anything away from this video, it'd be this. Just because things are hard doesn't mean that you should not go for it. Hustle and heart set you apart. When you find your true purpose in life, you forget about all the sacrifices, challenges, and all the hours that you put in. Because at your core, you're driven to reach your destination and become who you were put on this earth to be. Do not downgrade your dream to fit your current reality or comfort level. Once you find what sets your soul on fire, you have to choose to jump in wholeheartedly without ever looking back. You have to believe in yourself relentlessly and never waver. Those are the secret ingredients to reach your highest aspirations, no matter how uncomfortable it may be at times. The moment you decide to believe in yourself and know that you are capable of anything you put your mind to, heart, and soul into, you become unstoppable. And don't forget, along the way, you have cheerleaders and people on your side who want to watch your dreams come to fruition. So thank you for watching my video. I hope that if you guys have any questions or want to know more, you reach out and keep being great.